Welcome to the Grow Strong Leaders podcast. I'm your host, Meredith Bell, and I interview business leaders who are committed to their own growth and the development of everyone on their team. If you enjoy my podcast, be sure to subscribe and rate it on your favorite podcast platform. Thank you for joining me for another episode of my podcast. I'm your host, Meredith Bell, and I love bringing to you guests who are committed to their own growth and development and also to the development of the people in their world. And I've got a wonderful guest today who's going to do just that. Her name is Liz Bruno, and I want to welcome you, Elizabeth, to my show.
Oh, thank you, Meredith. I am so excited to be here.
Well, we'll go with Liz. Liz is the Vice President and Chief Learning Officer at Baptist Health System in Jacksonville, Florida. She's a rare CLO in healthcare because she's had both the clinical and non-clinical training. On the clinical side, Liz is an advanced practice psychiatric nurse with experience in acute care, forensic care, and private practice. And as an educator, she has taught nursing and leadership on the graduate and undergraduate levels. Liz has held leadership positions in learning and development for a number of different healthcare systems in the Southeast. And since joining Baptist Health in 2015, Liz and her team have designed and implemented innovative programs in both the clinical and leadership development arenas. So Liz, this is really, different in terms of other guests that I've had, this experience you've had in healthcare on both sides. And these days, the last 2 years, in fact, have been even more challenging for healthcare than previously, even though I know the systems have been pushed in many ways in the past. So I'm really eager to share with my audience the things that you're doing that have really made a difference. Is there anything related, though, to your journey first that you think would be useful for my audience as background to the kinds of things we're going to be getting into discussing today?
Sure. When I thought about being on your show, and I do appreciate the invitation, the area I really wanted to focus on was compassion and connection. And, people go, oh, you're a psych nurse, you're all touchy-feely. Well, the issue truly is today, if you think about everything we've gone through as a country, we are in many ways so divided. We're in our bubbles. And if you're not in my bubble, I don't trust you. Or if you're not in my bubble, whatever. And that impacts everything that goes on in your world. And people often say, well, that doesn't impact me at work. And that's really not true. Because as we look at the challenges we're facing across the board, not just in healthcare, but in every area, what we're hearing more and more from our teams and what is in the literature, and if you look at anything and look in Forbes, look in Wall Street Journal, people are looking for connection. People are looking for feeling they're part of something bigger. They don't want to be a cog in the wheel. And so that speaks to a need to develop skills that are maybe different from a lot of folks, because when we talk about empathy and compassion and connection, despite everything we've gone through, we still have so many leaders who feel that all of that is over here and it's mutually exclusive to accountability. And that's so not true. It is so not true. So just sharing a little bit about my background. As you said, I'm an advanced practice psychiatric nurse by background. But before that, I did a lot of other things. I was a professional dancer. I was also in the Army Reserve, Nurse Corps Reserve status. So I've had a long and storied background. But what I think is important, maybe just a little bit more self-disclosure than maybe is ordinary on your show, is that I grew up in a family with 7 brothers. and 6 of them were born with a blood dyscrasia called agammaglobuline anemia. Long word. Basically means that a component of their in their body, gamma globulin, was missing. So they were chronically ill. And so my mom was a nurse, my dad was a pharmacist. And so all of that, I grew up watching my parents and amazing healthcare workers take care of chronically ill children. That's the world I grew up in. And so I watched compassionate care at at my mother's knee, but I watched it in so many different healthcare settings, so many different hospitals over many years. So when the time came for me to stop dancing and I became a nurse, I knew that that was one of those elements that I needed to really focus on. Now, everyone says, well, nurses are compassionate by nature. Yeah, yes and no. Okay. We're people just like everyone else. And so the compassion piece, as I have moved into training and education and leadership development, one of the things that I've seen over the years is that there's a disconnect. There's been a lot written in the past 20 some years about empathy and compassion as core elements of leadership. But it's been embraced to different levels. And so I've really tried very hard in all of my work to talk about the importance of empathy and compassion as a foundational, for want of a better term, competency in leadership. So that's one of my big soapboxes, I suppose. So here at Baptist Health, we do a great deal of a focus on compassionate communication and compassion in leadership. But I think there's so much room for growth and so much room for expanding this, because a lot of people have misinformation, or from where they're sitting, it doesn't seem important.
Mm-hmm. Well, let's talk about that. What is it you're seeing that you would describe as misinformation? What are some of the misconceptions people have about compassion? And the second part of that is, how do you help them adopt a different perspective?
Excellent question. I think first, as I said before, a lot of people think if I'm compassionate or if I show too much empathy, then I won't be able to hold people accountable. And, there is a grain of truth in that. And here's what it is. Empathy is I feel the feeling and I understand. I feel your feeling and I understand you, right? I understand where you're coming from. Compassion is related but separate, because that's the action part. That's I have the intention of doing something. And there truly is a little bit of a pothole that people can fall into, because if you just stay with empathy, you will become, truthfully, on so many levels, ineffective, because there's really important hard work that happens in leadership. There's coaching and there's discipline and there's terminations that have to happen. And if you're just sitting on the chair of empathy, you're not going to be able to do that. Plus, you will be eventually into fatigue, right? What happens to people who are overly empathetic, and it sounds like I'm talking out of both sides of my mouth, but I'm not, is that you reach a point as a leader where you're so you can't make a decision because you want input from everybody constantly. You're going to focus on consensus. Everything has to be by consensus. I have seen leaders and I've consulted in many areas beyond healthcare, where they become so focused on taking care of everyone that the mission falls to the side. There's real life work that we have to accomplish as leaders with our teams. And if you become so focused on just empathy, then you're not able to do it. And so that's where you have to step back. You feel the feelings, you understand, and then you step back and you have to be able to think through, what do I need to do to assist, but not sacrifice the mission, whatever the mission is, the day-to-day work, the project, whatever. And there's another big old pothole that I've seen. You know, in healthcare, I'm sure you've probably read about it. You know, during the pandemic, you've heard the term compassion fatigue, right? So very, very frequently, sympathy, empathy, and compassion kind of get smushed together, right? And for purposes of leadership, I really like people to be very, very clear on where one starts and another begins. Because when you give and give and give and give, and you are connecting and connecting and feeling all day long, you will reach a point where you will wake up in the morning and you will look in the mirror and you will see dead eyes, because you don't have anything left to give. You have nothing left to give, because when you're doing that 99 times out of 100, you're not taking care of yourself. And, you know, this is what happens very, very often. We see burned out leaders and they don't see it. They do not see themselves as changing. They do not see it. And so they kind of go to the other end of the spectrum out of sheer self-preservation. And so you'll see a leader who was very empathetic turn into someone on the, as again, far end of the spectrum, who now becomes everything is nothing but rules, no connection, and I have to keep you at bay just to survive.
So, Liz, this is important because I'm sure some of my listeners have gone through that very thing. No matter what role they have, there are times that if they're a caring person and they're giving to others and not taking care of themselves, they reach the point you're describing. So what are some interventions that you do, or, you know, what are some insights you can share that could prevent someone from getting, I don't want to say that far gone, but that far along the continuum, that they reach that point where they just don't have any more to give?
You know, that is so important, Meredith, because people don't look in the mirror. You know, self-awareness, if you go back to the fundamentals, self-awareness is such an important part of everything we do. And it sure as heck is an important thing to have when you're a leader. And what happens is, depending on where you are in a food chain, oftentimes people won't talk about the fact that the emperor is now naked, right? I'm not going to tell them they've turned into the Wicked Witch of the West. I'm just going to try to hide under my desk when they're coming by, right? And so one of the things that I've seen over the years is the importance of coaching. I think that every leader needs a coach. And I have to admit, I am not one. There are a lot of people who are excellent coaches and they are certified, etc. And I try to link people up with coaches all the time, because it is so important to have someone turn to you and say, ask you the questions that are going to make you look at yourself. Because we don't necessarily do that very well. One of the other things I think is important is peer coaching. You need to surround yourself as a leader. Well, maybe surround yourself is the wrong thing. You need to have a couple of people, at least one, who is determined, and you've made a bond, and you have agreed to give each other feedback regularly on what you're seeing and hearing. and that you, as the person receiving feedback, are going to be open to it, and you're going to say, thank you, can you tell me more?
Mm-hmm.
That is so, so important, because frankly, not everyone has the benefit of a coach.
Right.
But peer coaching is very, very powerful, so powerful. And so I really think that's an important thing. You've got to be able to look in the mirror. Have you ever shopped for a bathing suit?
Yes.
Don't you hate it?
Yes.
I hate shopping for a bathing suit. I have a theory that the lighting is designed to make us feel bad about ourselves, and that the mirrors are not accurate. That's just me, just saying. I think, distortion is an important term here.
Mm-hmm.
We can look in the mirror and what we're seeing is not necessarily real.
Mm-hmm.
We think we're walking that good line of being that connected, compassionate leader. And maybe we're too much on this side, the overly empathetic leader, or maybe we are becoming the wicked witch of the West. Because, and you would think, I guess it's strange, but you would think in this day and age, we would not hear, look, you're getting paid every 2 weeks. That's all I need to make sure they get. They're getting paid every 2 weeks. I don't need to recognize people. I don't need to do X, Y, and Z. They're here for a paycheck, and I'm here to make sure they do what they're supposed to do. You would think that that was rare. Now, I will tell you, at Baptist Health, I don't see that. And we work really hard to give our leaders what they need to become better. But as I interact with chief learning officers and other leaders throughout the country, I'm still hearing that. I'm still hearing about that. And so when I say that when people look in the mirror, there may be a distortion, that's one of those things that gets in the way of you taking care of yourself.
Mm-hmm.
Someone needs to be able to say to you, you have become impossible to live with, or you have become ineffective,
Mm-hmm.
or you are reaching the point where you have nothing left to give. And we need to be able to hear that. So some of those interventions are coaching, peer coaching. And, I've often said this when I've taught leadership classes, when something goes wrong, first, and of course I'm a healthcare person. So make sure the patient's breathing and the bleeding is stopped, no matter what the situation really is out in the real world. The first vital sign you have to take is your own temperature. You have got to be, where am I? What am I feeling in the moment? So that your interventions, your responses are not just born strictly of the emotion of the moment.
Mm.
You've got to take your own temperature. You've got to look in the mirror. Sometimes you've got to look in the mirror and say, what part of this do I own? Before you go out and you start looking for all the other causes.
Mm-hmm. Wow, Liz, you've packed a lot there into that answer. And all of that is so important. One of the key things that you mentioned around peer coaching, which we're big fans of as well, is this idea of having someone that really will tell you the truth. And that, I think, is a key underlying thread there to what you were saying. When you were describing what a peer coach could bring up to another person, that really requires a lot of trust. And I think that's an important thing to look at when choosing someone to be a peer coach. Yes, they're going to hold me accountable, and they're also going to tell me the truth. They're not going to, sugarcoat it. They're going to be direct with me, and I can be that way with them. So the relationship has to be pretty strong, I think, to have that kind of support, because it's a combination of support, encouragement, and that truth telling about what they're seeing. I love what you just said. I think that's very powerful. There's another element too that you bring out there at Baptist Health that's such an important piece. The compassion is one part, the connection is another. And I would love for you to talk about what are some of the ways that you help people connect with each other as coworkers within the organization, but also with patients, because those are, similar but different.
Absolutely. That is so true. I'll start first with how do we help people connect with each other? So here at Baptist, we have, as part of our initial DEI strategy, we built these. We started with just a couple employee resource groups. Well, that has blossomed. And now there are different groups connecting people with commonalities. But the other thing is sharing differences. And that has truly become a powerful force taken off here at Baptist. And I think those things are really important. And a leader, pretty much anywhere, I don't care how big or small your organization is, all politics is local, right? Everything is people are people, and you bring your whole self to work, right? You bring your whole self to work. One of the things we try to do as part of onboarding is help people hook up with folks who have similar interests, who have similar backgrounds. So they start to, they have that sense of security and trust early, and you have something that you have in common with that person. We do a lot of cohort training. We bring in nurse residents in large cohorts, and they connect with each other over the course of their education. And so while they may be dispersed out to 6 different hospitals, they still have those connections. And we work really hard to help people build those. And frankly, we work with managers to help them see that that's an important thing they can do. We have, there's a director of whom I'm very fond, and she works at one of our hospitals. And she, after basic onboarding, she brings everyone together and works really, really hard with her managers and with new team members to help people feel part of something bigger. You're here at Baptist South, and this is who we are. And we want you to feel part of this family of Baptist South and part of the bigger family of Baptist Health. And she works very, very hard at that. And frankly, it bears fruit from the standpoint of recruitment and retention and overall engagement. So all of those things are part of they're the sequelae of helping people be connected, right?
Mm-hmm.
So when we look at people want to feel part of something bigger. How do we connect people? Well, you got to work at it. You got to be intentional. You cannot just wiggle your nose or a magic wand and make that happen. It's intentional, it's work, and it's structured. You have to think it through.
Mm-hmm.
And there's a wonderful book that the Heath brothers did a number of years ago called The Power of Moments. They did such a great job in that book talking about connection and helping customers and employees be connected and having those special moments. Well, that's one of the other things that we try to do. And of course, being, a leader in healthcare, I cannot help but saying thank you for how do we do it with patients. So that's so important because we see people at their most vulnerable. A patient and the patient's family, unless you're coming to have a baby, and even then, you're vulnerable.
Mm-hmm.
And so the concept of connecting to patients is vital. Now, I will share a story. I was doing some work with one of our early residency classes, and I was talking about compassionate communication. And I'm up there and I'm doing the deal and I'm talking about how you connect and telling stories, and the audience is crying. And, that's one of the ways you've done a good job, right? So I had this lovely young woman come up to me after my piece of the whole thing was done. And she said, "Oh, Miss Liz, I have to tell you, I can never talk to people the way you do. I don't have the words. I would really, really like it if I could just text my patient sometimes. And I was like, oh, God. But she was so forthright. She really was. And it was illustrative of a component of a generation that is used to texting,
Mm-hmm.
that is used to emojis. And so sometimes we as leaders have to teach people how to connect. We have to teach leaders to say to their teams, I saw what you did in that situation. Boy, you really made a difference today, right? We have to be able to catch the years ago, what was it? Catch them doing something right
Mm-hmm.
and help them see, connect them to the broader meaning. So with patients, we actually teach people how to talk to patients, how to deal with patients when they're ornery. Because let's be honest, none of us are at our best when we're sick.
Right.
And I think I am probably the family member from hell when someone I love is in the hospital. And so, how do you help diffuse difficult situations, help people build trust with you, help them see that you are there for them? We work very intentionally on how to do that.
That's great. I'd love for you to give an example of something that you teach people to do and you've seen them actually put it into practice with a patient.
Mhm. It's funny. I used to think that everybody did this, but I use a phrase a lot: listen with more than your ears. If all you're doing is listening to the words, you're going to miss 90% of what's out there.
Mm-hmm.
So we teach people to look at the affect, look at the face, look at the body, look at how people are, they're saying one thing and their body is saying something else. Every 2-year-old knows if mom and dad say one thing and do another, pay attention to the behavior, right? So if a patient says, I'm fine, but their affect is telling you they're not, don't just stop there. Go underneath the words. You have to listen with your eyes and you have to listen with your heart. If you just listen with your ears, you're missing a whole lot of it. So we work and give people feedback on how they're responding to the unspoken. We teach them how to say, in situations like this, people often feel very worried and anxious about X, Y, or Z. It's almost like you're giving people permission to have their feelings
Mm-hmm.
and to be able to talk about it. So if you generalize that out beyond care at a bedside to a leader outside of healthcare, being able to listen with more than your ears is going, if you just do that, you're going to be a better leader. Just that. Start listening with more than your ears. Listen with your eyes, listen with your heart. You'll be a better parent, you'll be a better spouse, you'll be a better everything if you learn to listen more deeply.
Mm-hmm. That's such a great point and an important one. And thinking about it, knowing how to respond as well, so that as you're listening, you're not just noticing it and then letting it go. You're addressing it in some way. From what you were just saying, this idea of making a statement without somebody feeling like you're quizzing them and asking a lot of questions, but reflecting back what you're seeing and inviting them to share what's going on with them. As you were talking about the interactions with the patients, I thought, that's so true for any aspect of leadership and life. So I'm glad you made that point. It applies everywhere. We can, and don't you think a lot of it has to do when we miss it? It's because we're preoccupied with ourselves and thinking more about what's going on in our head instead of really noticing and attending to that human being right in front of us.
Mm-hmm. Absolutely. Honestly, one of the things, how about my phone? I'm talking to you, but I'm on my phone. Oh, good gosh. Okay. No, but I have seen leaders, I
Mhm.
have seen leaders do this, and that distraction. Oh, yeah, I'm listening. I'm listening.
Mhm.
That is, again, if you say one thing and you do another, people are going to watch the behavior. And so when I make eye contact, when I lean forward, I need to give you that sense of I'm connecting to you and I am hearing what you're saying. And frankly, I'm hearing what you're not saying as well. That connection there, I can't ask you to connect with customers or patients if I don't feel that you have the ability or desire to connect with me.
Mhm.
You can't give out what you ain't got,
Right.
is something I heard 100 years ago, and I've always thought it. So when when leaders want their employees to connect with customers, and in our case, patients, they have got to feel that you're connected to them, that you care, that they're not a widget. And so we have to teach, in many cases, our leaders how to do that. And we have to teach them that it's important. And so we have to say, here's what the research says. You will have enhanced loyalty. You'll have enhanced productivity. You'll have much better performance with customers if you, as a leader, demonstrate compassion and connection. If you foster it between and among your team, all of these things that you want, these other metrics that you're focusing on, that you're working on, they will improve, but you've got to take this step.
Mhm.
And for some people, honestly, it's not comfortable. You know, I go back to someone, oh, well, you psych people, you're all touchy feely. You know what? Everyone is a human. We're all human. And connecting to another person's humanity, it's risky. It's risky. It's hard. It's not always comfortable. And frankly, it doesn't always work. But that relationship is so important. That going back to the peer coaching piece of trust
Mm.
and building the relationship and focusing on truth. Part of compassion is giving difficult feedback, not just to your peer coach, right? And from your peer coach, but um, to your team. Being able to discipline and coach with compassion is vital. It's absolutely important. And so when we're teaching these skills about coaching and discipline and dealing with difficult situations, we have to be able to talk about the compassionate communication element, the connection element as well. Because when you do this right, you can turn someone who has bad performance, a bad attitude, you can make a huge difference. You'll not be able to salvage everybody. But boy, when you're able to do that, what a gift. What a
Mhm.
gift.
Well, I just can't even tell you how I love hearing what you're saying because you're reinforcing the fact that everyone has a need to be understood and valued. And when we can extend compassionate listening and a compassionate attitude towards another human being and not react to whatever quote bad behavior we may be observing in a given moment, but recognize there's a person beneath that superficial behavior who's in pain, who needs my caring about them and knowing that. And you may be the first person who's done that for them. To me, that kind of approach that you're describing, and I love the fact that I think it really permeates your culture, just listening to how you're describing not just what you teach, but what people practice with each other and with patients. It just gets reinforced all the time. And in the time we have left, Liz, I want to circle back to your family life. And you alluded earlier about growing up with seven brothers, and
Mhm.
six of them had this disease. And there's a lesson from that you bring to your leadership development programs. And so I would love for you to share, kind of the story. What happened with your brothers, and what is that lesson you take that you bring to leaders you work with?
Yeah. Thank you. I will. Those six brothers lived until they died. They were wonderful, wonderful people, and they died in their. One died at 10, and the one who lived the longest died when he was 38. Most of them died in childhood and teen years from complications of this disorder. One of the, I guess, the biggest lesson I learned is that what we have is right now. So often in this life, in your personal life, in your professional life, we feel like we have forever. We don't. We have now. One of the things I learned is that if you love someone, you tell them. You're not guaranteed tomorrow. When you have the opportunity with one of your team to connect, take it, okay? Because you may not have that opportunity again. My brothers were wonderful, brilliant, funny people. And in the family that I grew up in, we did not have any illusion of forever. And that has its own issues, right? Certainly. But it also taught me to take the moment and connect, to take the moment and celebrate. Celebrate wins with your team. Celebrate wins with your children. Take the time to let the person and people you love the most know how important they are, because you don't necessarily have tomorrow. That's how I grew up. And as I think about teaching leaders, you have the opportunity to make a big difference every single day. You said something a couple moments ago was brilliant. Maybe they've never heard anything before. Maybe no one's ever told them that they've made a difference. When a leader says to someone, I have faith in you. And I will never forget saying that to someone who then immediately dissolved into tears years ago. And I'm like, oh God, what did I do? I was really young, But this was a wonderful, high performing person who truly had a lot of self-doubt. And I said, I have a lot of faith in you. When they dissolved into tears and we got past the tears, this young man said to me, no one has ever said that to me before.
Mm.
As leaders, we have the opportunity and the gift to make a difference every day in the lives of the people that we lead, to inspire them, to help them see and grow into their best selves. We inspire. When you're an inspirational leader, you inspire the discretionary effort that's going to make all boats rise, that's going to hit all those metrics that you want people to hit. So when you connect, you have that opportunity. And I just hate to think of how many chances are just lost because people don't take the moment and understand how powerful as a leader you can be in the lives of the people who work with you, and how much of a difference then that will make in ways you will never, ever know.
Liz, this has been such a gift for me and for my audience. You have shared such important points about leadership and our own personal development. And this idea of noticing, connecting, showing compassion, all of these are so essential. And you really reinforce that point. You never know when one sentence that you share with somebody can have a profound impact on their life. So I want to challenge my listeners to think about who in your life might need to hear some positive words from you. Don't let that opportunity pass. Take advantage of the moment, because as you so beautifully said, Liz, there's no illusion of forever. We don't know how much time we have. So take this moment to make the most of it. Liz, you've been such a gift to me today. Thank you so much for everything you have shared. I love the impact that you are personally having there at Baptist Health and the ripple effect that your love, your commitment, your efforts, your compassion and connection are having with everyone that's in your world. Thank you.
Thank you so much for having me. I really enjoyed our time together, and thank you for letting me share a little bit about what we're doing here and a little bit about my life. And best wishes to you and all your listeners.
Liz, if there's somebody who would like to connect with you and reach out to you, what's the best way for them to do that?
My email, and I think we can put that in the notes if possible.
Mm-hmm.
But my email is here at Baptist is Elizabeth.Bruno. It took me a minute. I was trying to remember. What is it? Elizabeth.Bruno@bmcjax.com. bmcjax.com.
Great. Thank you, Liz. Again, I appreciate your being with us today.
Thank you.
Thanks for tuning into my podcast. Now head over to growstrongleaders.com and check out our 2 books, Connect with Your Team and Peer Coaching Made Simple. While you're there, download the free facilitator guide to find out how to implement our unique peer coaching system. Until next time, I'm Meredith Bell.